Welcome back, folks, to Western Mass News, your school authority here on ABC 40, where we continue to provide you the latest info surrounding the pandemic. Thanks for joining us. I'm Brittany Murphy.
And I'm Taylor Jacobs. Right now, there's so many questions surrounding the schools. That's what this whole half hour is really on, to focus on your concerns.
Joining us this afternoon, Dr. Erika Hamilton, microbiologist from UMass Amherst, answering a few of our questions. So starting here, as we approach the colder months, what are some ways parents can keep their kids active while schools are closed?
So for people who have done it so far, you've probably noticed that remote learning is harder than in-person learning for numerous reasons. And one of them is this lack of movement, this lack of activity, and this lack of interaction. So there's a big difference for kids and even adults between sitting in front of a computer for classes versus being at school where they can talk to other kids. There's other things to see. There's the advantage or the ability to have a lot of physical movement. So because kids are losing that this year, or at least for this fall, any activity that families can find that gets kids moving, that would be great. Now, most outdoor activities, whether, playing tag, going for a run, going for a bike ride, can still be done as long as you're dressed appropriately. Once we have snow, there's lots of fun things to do in the snow, sledding, building snowmen, skiing, snowshoeing, things like that. Those are all fun. Sometimes the weather doesn't cooperate. You're stuck inside. So again, any activity that gets kids up and moving in the house, playing hide and seek, dancing, coming up with plays and acting them out, having them help you make dinner or make dessert to go along with dinner. These are all things that can keep them more active during the year.
That's a fantastic answer there, Doc, and some good insight. And let's stick here with all of this giant topic here of COVID-19. And since Governor Baker is mandating children get their flu shot before returning to school, should parents expect that the COVID vaccine might actually be mandated the same way once it's available, of course?
Yes, I think it will be. I believe that you'll see a COVID vaccine required for children to go back to school. Now, this will take a while because vaccines have to go through clinical trials in adults first. Once that is done and the vaccine manages to get through the adult phases of the clinical trials, then it's done in children. So vaccines for children are going to take longer before we get to that point where kids can get them. But yes, once we have a vaccine for children, I'm guessing it will be mandated. Overall, children do not become as ill with COVID as adults do, but this is not 100%. Some kids can get very sick with it, and also kids can pass it to other people like their teachers, parents, grandparents, and other adults in their families. So it will probably be on the vaccine list at some point.
Absolutely. And when students do return to school, what are some issues that may arise for teachers and parents in terms of getting back into a routine and really being disciplined?
So everybody, whether you're an adult or a child, want to go back to our normal pre-COVID days. Everyone's being driven crazy by this. This isn't going to happen for a while, though. So kids may be glad to get back to school because they're going to see some of their friends, and there will be some normalcy back in their lives. But remember, school will be different for them. There will be fewer kids. There will be social distancing, wearing masks, things like that. And this can be really stressful for some children. And also, depending on their age, they may not be able to articulate that they are upset or stressed about it. So some things to look for are changes in behaviors for your child. So a child who's normally chatty being overly quiet, or the opposite problem, someone acting out or talking more than they normally would, trouble with academics, being frustrated easily, being tired a lot, things like frequent headaches and stomach aches that can't be related to any other health problems, having trouble sleeping, and then any other change that you see in your child that seems kind of different can indicate stress. And so if your child is presenting with any of these issues when they return to school, get in touch with your pediatrician to get some advice on how to reduce stress in your child.
Useful stuff, as always, Doctor. Thank you for coming on here today. Dr. Erika Hamilton, a microbiologist from UMass Amherst. Be well, all right?
And a reminder, Western Mass News is your school authority. We're working to answer your questions and concerns about the school year. Call our newsroom, 413-846-0200, or email us, schoolauthority@westernmassnews.com.